My name's Jane Gazine and I'm on the faculty at the School of Music at Memorial University, and I'm also cross-appointed to the Faculty of Medicine. I lead the Better Breathing Choir, which is a choir designed for people with lung disease or wanting to improve their health through singing and gentle exercise. So I formed the choir in 2016 as a research project, and it was in collaboration with a medical student who was interested in doing some research around the benefits of singing for people with COPD, which is chronic obstructive pulmonary disease. Our goal with that group was something very specific. We then broadened that into being more general for using breathing exercises and singing exercises for a broader population. And the way we run the choir is that I work now alongside a physiotherapist. So she and I lead gentle warm-ups in the session. We do breathing exercises and we do some chair yoga. We then do some vocal exercises and then we sing songs. Well, we've done some formal studies, and we've also just on a weekly basis had the opportunity to see what people are really valuing in the program. And I think the main thing that comes out repeatedly is the sense of being part of a group, having that support with people who understand what others are going through. And so they received support within the group because they were amongst people who understood what they were going through. I think the thing that I have found most rewarding are those people who joined the group when they didn't think they could sing and yet have become some of our most dedicated participants. Really making sure that everyone really understands that you don't have to be able to sing in tune, you don't need to read music, you don't have to sing in time, you can still participate at whatever level you arrive at. And a lot of people improve a lot over time and they're really excited when they do, but that's not the point. And just watching the joy that people get out of music making, which sometimes when you're working within an academic setting or a professional music setting can be lost, and we sometimes forget about that pure joy that people get when they're singing. And then just watching people leave sessions and talk about what it's meant to them, but it does have a powerful effect on their lives in ways that we sometimes forget.
My department was created in 2016, and the idea was actually to intensify presence of Opéra de Montréal into the community. How can we reach out to the community and make sure that we actually appeal to all groups of people who live in Montreal? And one phrase that I always say is like opera should be an agent of social transformation. What does that mean? What does that mean exactly? So it means that actually we bring wellness through opera, that through creation of opera, through different social programs that we create. So I built these programs whereby we co-create an opera. Co-creation is the basis of what I'm doing, meaning that professional artists are working with non-professional artists and they co-create a collective work of art, which is an opera. But also they use opera as a means to understand better the society, maybe to connect with themselves better. All the impact that opera can have socially and medically for them. We are currently working with the Music and Health Research Institute to document what we're doing. All of these programs, social programs, health programs, have an impact on the lives of those who participate in the programs. But we don't have data with that. And so we decided to pair with the Institute to be able to gather data, to start researching, to see the impact of those programs. So we have two programs currently now being researched with the Institute. The one called Breathing, for those who have long COVID, and the other one is with the transgender women, to see how the voice modulates, how it actually evolves from day one to the last day. And what I aim at is to have all of our programs researched by the Institute so that we can document all of the things that we do in health, as well as diversity and inclusion, to see really the social impact of everything that we do with opera.
I am Anna Zumbansen. I am a professor at the University of Ottawa and also the Associate Director of the Music and Health Research Institute. I was trained as a speech and language pathologist in France and then in Canada before, and I worked as a clinician before embarking in my research. And my role is mainly, I would say, to help the main director, Gilles Como, directing the institute, but also to participate with my research program in it. I am leading actually the research initiative called the Practices and Benefits of Singing on Health. And so in that way, a number of my studies I do are contributing to the institute. So be it the effect of group singing on aphasia rehabilitation, Parkinson's. I'm also partnering with Opéra de Montréal. My role here is actually really to be at the Opéra de Montréal to help them showing the beneficial effects of what they are doing already. And so I am helping them to apply some scientific methodology to show the effect that they are feeling, but that they cannot document with the rigor that we can bring as a scientist. I feel that the role of the Institute is exactly this, to put together people from different areas. This institute is really on a great journey to make music and health more credible in all these relationships it can have between these different groups of people working in that area. In continuation with my clinical work, I actually now do more and more research in the health of singers, amateurs and professionals, and this is why in the lab right now we have a cutting-edge device to do that. This is a laryngoscope. We can look at the larynx, at the vocal folds vibrating in real time. So we are using ultra-rapid video cameras to do that, and the value of that in research is that it allows us to see the real slow motion of vibration of the vocal folds, and so we're able to see if there is any asymmetries or if there are any abnormalities on the vocal folds while vibrating, which cannot be done with traditional laryngoscopy devices. So Gilles Como had really this vision of this research institute. What can be seen in the institute, it's really his strength to bring people together. Bring people together and have them work together towards this vision he has and that he shares so well. So this, I would say, is very inspiring. Yeah, I think to me the Institute is really bringing something new in the area of research on music and health. I come from a research center that was on music and health in a way, but it was much more concentrated on neurocognitive aspects of music. And so I feel with this Institute it's like a step towards more applicable research, bringing in, looking at more practices that are actually happening in our world, in our communities. And so this aspect of applicable research is really important in the Institute.